4. This is the workshop for understanding intergenerational trauma and advancing ACEs for Native American and Indigenous communities. So hopefully everybody's in the right workshop. All right, I'm going to introduce our speakers for today and read over a little bit of their bio before I turn it over for their presentation. So Mr. Angel Galvez is the Chief Executive Officer for Bakersfield American Indian Health Project. Mr. Galvez has worked in the Indian health field with the vision of serving everyone with dignity and respect, starting as Chief Operating Officer for the Tule River Indian Health Clinic, Tule Reservation, and then eventually serving as CEO for Bakersfield American Indian Health Project. Angel's impeccable background in finances, leadership, management, and development, his well-rounded experience and organizational finance, leadership, management, and development
Come here.
has prepared him to bring parity to the unserved and underserved population here in Kern County. Angel earned a master's in administration organizational leadership degree from Fresno Pacific University, as well as a bachelor's of science degree in criminology with an emphasis in victimology. Angel is married, has 3 children, 2 daughters and a son. And the family loves to participate in church, be involved in youth sports and activities, serves on boards and in his community. Our next speaker is Johnny Delgado, who is the Grants Program Director at Bakersfield American Indian Health Project. Johnny was born and raised in Bakersfield, California. He has years of administrative experience with a focus in human resources. Johnny is married and has 2 boys and 2 girls. His wife and children are Tuba, and Johnny joined Bakersfield American Indian Health Project team to honor the culture of his wife and kids by helping them Bakersfield American Indian Health Project provide services to the Native community here in Kern County. Finally, our third speaker is Evelyn Eterno. She is a licensed clinical social worker for Bakersfield American Indian Health Project. Evelyn is a native Cherokee descendant through the maternal side of her family. Evelyn is a licensed clinical social worker and the director of the Behavioral Health Department at Bakersfield American Indian Health Project. Evelyn earned her Bachelor's of Arts degree in 2000 from CSUB. Evelyn continued her education at Cal State Bakersfield and graduated as a Master of Social Work in 2004. Evelyn continues to pay it forward by providing field supervision for CSUB's social work students at their assigned internship placements as needed. So with that being said, an introduction to the Bakersfield American Indian Health Project, I would like to turn it over to Angel.
Okay, go ahead and do the screen share. Hello, everyone. I'm Angel. I'm so delighted to see so many participants join our workshop. It's really good to have you here. I hope today to really just offer a little bit of context, some statistical support in the subject that we'll be talking about, intergenerational trauma, historical trauma, and offer hopefully a bit of information as to what we do, who are we, where are we, what does our community look like, all of those sorts of things that I think are important when we're talking about, adverse childhood experiences, specifically among the American Indian and Alaska Native peoples. Of course, much of our work that we do, we also serve non-natives, more specifically with prevention and engagement with COVID-19 and the vaccines, and then just keeping really indigenous communities healthy. And so often our clinic will also serve indigenous communities who are maybe American Indian, Alaska Native communities. Well, I won't delay the presentation. I do ask if you could, it would help us tremendously if you can put your, you can turn on your mute on your phone or mute on your computer. That would just make it much more easier for us to present. Very quick, to my left is Miss Evelyn, and to her left is Mr. Johnny. And we're going to lean on each other for this presentation. So I hope to make it interactive. If you have a question, we've decided that we're going to go through the presentation rather promptly. I know we're going to be approaching the lunch hour. Feel free to eat while you listen. We hope to make this engaging for you, and there will be an opportunity for you to ask some questions toward the tail end of our presentation. So definitely write your question down, submit your question through the chat, and then we'll answer the questions in the order received at the end of the presentation. We're going to allow some time for that. So who are we? Hey, Johnny, I'm not able to. It's on. It's on. Just next slide. So try one more time. There we go. So who are we? Well, we're considered an urban Indian health organization. And there are 10 urban Indian health organizations in the state of California. The Urban Indian Health Organizations is funded through the Indian Health Services under Title V through a compact agreement under the Indian Self-Determination Education Assistance Act. And just to offer a little context, the reason I share this slide with you is because there are only 10 urban Indian organizations. Most of them, in fact, all nine out of the 10 are ambulatory clinics, meaning they are full-scale health clinics, similar to those kinds of health clinics that you might visit for your own healthcare. Those operations are full ambulatory. We are considered still in outreach and referral. And by its own nature of outreach and referral, it just means that those who seek services here at our Bakersfield Indian Health Center, we contract that care because this organization has only recently been in a expansion development mode. And you'll learn here where we're going with, and I'll share an overview of those services we do offer here. But we have made an enormous jump and a leap forward for us to also become an ambulatory healthcare facility. I'd like to just read in a study by the American Indian and Alaska Native mental health research journal published by the Centers of American Indian and Alaska Health and Colorado Schools of Public Health. They published this article, and it states that the AIAN, and you'll hear me refer to the American Indian Alaska Native by its acronym. Sometimes I will say Native Americans, and I will use various words to describe the very same people that we serve. The AIAN over the age of 12 were more likely than members of other racial and ethnic groups to report an alcohol or illicit drug use disorder in the past year. And this was a study that was done about a decade ago. And so we acknowledge that there is so much trauma within the within communities in general, but the traumas that exist in American Indian, Alaska Native people and Indigenous people, is much more related to intergenerational transmission of historical traumas among urban American Indians and Alaska Natives in a culturally specific sobriety maintenance programs. So I show you a picture of our two clinics. The clinic that has the 1617 30th Street address has been our clinic for the last 20 odd years. And the the clinic next to it is a new site that we were able to purchase through the American Rescue Plan Act of 2021, which resulted in the infusion, actually in the largest single infusion of federal funding for Native American and Alaska Native health centers. The funding also has been used to enhance our ACEs work in violence prevention, outreach, and engagement. And you'll hear from us.
I don't think any
today
of us have
in what way
microphones,
that
do we?
has resulted.
Here?
If you guys can mute your phone, please, we're getting a little bit of background. I'd really appreciate it. Thank you. The health center that looks like an H shape, the 501 40th Street, is the new building that we were able to purchase this at the tail end of last year and has recently gone through extensive renovation. We expect to move in April, and we will no longer be at the existing site. So we're moving out from what was once about 2,800 square feet of leased space to a 14,000 square feet of owned space. And we're very excited about that. We can't wait. And the reason why is because a lot of the work that we knew was important for our Native American communities could not be fulfilled from the space that we currently inhabit or occupy, I should say. The new space offers an opportunity for us to really design a new program. It's titled there, the Indigenous Wellness Center. So a large part of that's roughly 14,000 square feet is going to be a site that we're going to dedicate for our Indigenous Wellness Center. And through that program, we will highlight what are going to be some of those services that we currently offer at a micro scale here at our current site, but will be full scale, full-fledged funded programs for the new site. Thankfully, we were able to acquire also right around the tail end of last year with the Department of Healthcare Services, the mental health infrastructure funding that we applied for collaboratively with the local Kern County Behavioral Health Recovery Department. And it was through that collaboration that we were aware of this funding, and we joined together to really go after those funds to provide infrastructure and development and design for an Indigenous Wellness Center. And we say Indigenous because sometimes even within our own people, we have a very diverse mix of American Indians that reside in Kern County. About over 220 tribal communities are represented just in Kern County. So you could only imagine the similarities and the differences that exist from the people we serve. And so Indigenous really captures the entirety of all of those who we serve. So a little more on the lines of historical trauma, and here's just a small chart of that historical trauma, and I'll touch a little bit on a few of these areas. Part of really understanding our people is to understand the really to understand the history behind why many of our people continue to experience these traumas. And so I want to just cover or explain, I should say, why some Native individuals are subject to substantial difficulties studied by Braveheart and DeBruyn in 1998, utilized the literature of Jewish Holocaust survivors and their descendants and pioneered the concept of historical trauma. The current problems facing the Native American people may be the result of a legacy of chronic trauma and unresolved grief across generations, enacted on them by the European dominant culture. And the primary feature of historic trauma is that the trauma is transferred to subsequent generations through biological, psychological, environmental, and social means, resulting in a cross-generational cycle of trauma. So here in the first slide, in the smallpox in 1660, you know, we really find disease being the disease that affected a large number of Indians, and the lack, or when we think of health disparities, the lack of appropriate healthcare intervention. You know, natives have always suffered the lower end of the stick, for lack of a better word, when it comes to health parity. If we move on, the extermination of 1853, the governor of the state of California then declared, made a declaration that all government officials go and exterminate all Indians living in California. So you could imagine the massacre that took over, you know, the 50 years of genocide and the massacre that occurred among, you know, among many Indians living across California. In 1877, we have the US government seizing native land. In other words, by that point, it was law that with treaties requiring Indians to reduce their land. You know, you have to understand, much of the land that you stand on today is land that belonged to Native Americans, indigenous to all of the US, right? But we're focused here in this region. Earlier this morning, it was really nice to have the invitation to read a land acknowledgement, and we will cover, you know, where are we today and what are we doing for healing. And so, you know, that'll be covered here later in the presentation. But the land acknowledgement really, really puts forward the respect and the honor that the people who are indigenous to these lands deserve. And that brings healing, and that brings light to a road of recovery and a journey to wellness. The ghost dance movement of 1889 has a lot to do with the conflict between the spiritual, you know, our native people are very spiritual people, are people that have traditions that date to the beginning of time for these lands. And so Mother Earth, you often hear these terms used: Mother Earth, Creator. You'll hear land, the eagle, our feathers, our, you know, those kinds of words describe the spiritual and the emotional being of our Native American people. Little things like if you are invited to a reservation and you pull out a piece of gum, you chew that and you throw the wrapper on the floor, something that perhaps is not much of a issue at the local Walmart or the local Target will be an insult to a reservation on littering on Mother Earth, as we call it. And so these are the traumas or the triggers, if you will, that set us off often from people from the outside. And because it's the lack of awareness sometimes, or the lack of knowledge, that leads to these very small nuances, if you will, of impact to triggering the historical effects of the traumas that our Native American people have gone through. One thing that I'll say here is that in 1893, with the boarding school policy, and I'll move on to the next slide, is you can read here where the stripping away of identity, and that's something that we have tried to really work hard in, and you'll see through the various slides that are next how we have been bringing back identity and culture and language. For example, in Tule River Indian tribe, the language of their people, or at least the language that they have adopted, is the Ulamni language. And we have that on our website available for folks to download and read and thumb through that. But there are many different languages because we have many different many different tribal people, if you will, that live in Kern County and exercise their language. So the reality of the cycle of historical trauma is something that points really to the studies that have been extensively done to highlight the statistics of how many American Indian, Alaska Native, indigenous people suffer with these kinds of traumas that lead to harm. And it was really nice to hear other presenters touch specifically in the morning session about, mental health and behavioral health and substance use and the work that's being done there for ACEs. The ACEs work that we do is a bit different than the conventional way of doing ACEs, perhaps in other racial and ethnic groups. More specifically, we're dealing with communities where we're attempting to reduce the harm. Many of our communities suffer with the plague of, suicide, drug addiction, alcohol addiction. All of these things affect the general population of all of our American Indian Alaska Natives in Kern County. So to share just some interesting facts about the healing and the path to resiliency, I won't mention all the ones that are on the slide, but what I will mention is that we have countless leaders in our Native American communities, well known for their work in really working with government to not to undo what has already been done. And meaning, like the land acknowledgement, for example, that's something that in many different tribal communities, they have worked with their leaders, their elected leaders, if you will, on really advocating for acknowledgement that buildings have been built on top of grave sites, and an acknowledgement that there are indigenous people who were once here who would love to have some of or most of their land back for cultural and traditional practices. And so really a lot of them have made it a lifelong mission to support these kinds of equality initiatives, if you will, for the people that they are members of. For example, you have a few examples here where leaders in government have provided the inclusion, with Ronald Reagan designating September as American Indian Day. And so we celebrate those kinds of holidays, if you will, culturally, linguistically, and traditionally appropriate as it fits our community. The National American Indian Heritage Month, that is another event, and we'll show a few slides here in a minute of how we integrate culture and tradition into the practices that we do, but also celebrate them near these monumental type of holidays. And so last year in November, we had a inaugural event over in the Marriott where we promoted Rock Your Moccasins. So you'll see here the regalia, and I guess that's a good segue for me to jump into this slide. So who are we? What is it that we do? Bakersfield American Indian Health offers essential services for medical health. We provide eye care, dental care, and other primary medical essential care, such as special diabetes for Indians. We have nutrition, a nutrition coordinator, and we also have a behavioral health department. So we provide mental health, and Miss Evelyn will cover that here soon in her slides. But just to offer you a glimpse of our people, drumming, sweat, smudging. We had a smudging ceremony earlier where the smudging was offered as a prayer for this conference, and we were very honored to be invited to do that. Smudging is something that is very sacred. It comes with permission. There are only, we refer to them as cultural brokers, as our community healers, our cultural coordinators. There's many terms that are used for the individuals that have been given a rite of passage to perform smudging, to do ceremony, to offer prayer. And so we lean on those leaders from our community, and thankfully we have hired staff members who identify as Native American and have been given that rite of passage to perform that. So that's a huge asset on our end. You'll see here that basket weaving, beading, those kinds of activities are essential for healing. You know, it's a way for our elders, our young adults, our youth to really engage in what we refer to as talking circles and really support and really receive the support of a network so that these individuals can continue to be resilient. You know, our people are resilient people. The people of Kern County are resilient people. The indigenous people have lived here and are still here. And, you know, you often hear that sometimes like, hey, Indians are still here. Well, of course they're still here. They never left. But the expectation from the community is sometimes to see us in regalia walking the streets. And so we often will have this as part of our community events to engage with the community and to demonstrate some of the dancing, the drumming, and other like activities that lead to wellness in our community. So again, here is just a very important slide or picture, if you will, was in an event that we just had last Saturday. The gentleman pictured at the lower left of the slide kneeling in front of what appears to look like a few tools. He has a clap. This talking circle was all about Native American tobacco. And we use ceremonial tobacco, not similar to commercial tobacco. So we educate our kiddos about safe use, the use of tobacco, sacred use of tobacco, proper way of offering back to the land. These are all very important cultural and traditional ways of healing. And so when we talk about identity, you'll see around the picture a few youth who have participated in this talking circle, and were very engaged, were very interested, felt like a part of them exists within the sacred offering or the talking circle. Sorry, let me go back a slide. So I'm going to turn it over to my colleague, Miss Evelyn Eterno. She's going to share a few slides, and she'll talk a little bit more about just the trauma specifically. I know I kind of just gave you a little bit of an overview, and again, we'll lean on each other need be, and we'll offer some time here soon to do a Q&A. Ms. Evelyn?
Thank you. No, that
Okay, I'll do it.
Johnny did. Okay, thank you. When I was researching a little bit more in depth about the services we provided and our ACEs, what I found was we had a very high rate of adverse childhood experiences among our Alaska Native and our American Indian clients. The ACEs included like abuse, neglect, chaotic home life, all emotional abuse, sexual abuse, physical abuse, witnessing a lot of violence in the home, or living with someone that's using alcohol or drugs. So when we were looking at that, I looked at the research as well. Research has shown that there's a correlation between ACEs and moving into adulthood. We found food insecurities was an issue, intimate partner violence, depression, high rate of suicide attempts and ideations, alcohol and substance use, definitely a high rate of chronic drug dependency, smoking, risky sexual behaviors. And we have a high rate of diabetes and obesity in our Native populations. When I did a little bit more digging into research, we found that Native Americans have the largest number and greatest variety of ACEs when compared to other race and ethnicities. Go ahead. Three of the factors that came up for us as we were looking at our populations is three factors are important when considering the use of ACEs with our American Indian individuals. Population characteristics was at the top of the list. Historical trauma and resilience and tribal sovereignty. What we found is a lot of times individuals won't claim or report being Native, and there's no category for them to report that on some of the forms and some of the government forms. So they're included in the other category, which overlooks all of our unique cultures. Each individual tribe is different as far as their culture goes and their history and the context of the tribes in California and the United States. There's definitely a different context, different history across the tribes in general. So what we were doing is to improve our work with ACEs, we want to make sure that we are oversampling. We want to get as many ACEs questionnaires completed as possible. We want to do our research on that. We want to analyze what's going on for the states, the regions, for Kern County, so we can go after additional grant monies to provide supportive services in the home and in the community.
So one of the ways that we accomplish that right now is the medical department and the behavioral health department for our organization is integrated. The ACEs assessment can happen in both areas. Often our community will only come for, a request to be referred for dental care, for example. That screening is done on that individual. Those screenings are shared with Ms. Evelyn and our licensed clinical team. Our doctor often performs these assessments. He has been trained in this work, and so integration of collaborative treatment is essential to those who score high and are referred to additional care.
What we found the best way to achieve comprehensive ACEs results was requiring a direct partnership with all of our tribes and tribal leaders in Kern County and throughout California. from our behavioral health perspective, we focus on what ACEs could provide as far as long-term benefits that include alcohol and substance use counseling, behavioral health intervention, prevention, and postvention services. We address ACEs. Our therapists and our substance abuse counselors include traditional healing practices, which includes drumming, basket weaving, song, dance, storytelling is very important to pass down generational information. Engaging our natives in their own language. We have a variety of unique languages in Kern County. And supporting the values that sustained all of our natives for hundreds of years. We want to keep doing that. Therapists and the counselors benefit from knowing what the cultural elements are that will foster resilience. And that's very critical in developing effective ACEs prevention and intervention for our natives.
Sorry.
Go ahead.
I was gonna make a quick comment. You know, many of you probably have heard the notion it runs in the family. A lot of the studies that have been done in American Indian, Alaska Native research really highlights the fact that, you know, it quote unquote, it runs in the family is really a true transparent way of looking things in Native American communities. And the reason why is because it all points back to the trauma, the historical trauma, the intergenerational trauma that the next generation or the existing generation is almost born with these traumas. And so we often serve children who experience, who may come from a somewhat stressful environment, but might not have all the stressors that perhaps, current, like violent, a child who's coming from a violent home, sexual assault, very broken family environment, children who are from what you would probably call a normal environment, also experience these traumas in a very similar way.
That is true. When we look at the trauma, we also look at the trauma that occurs in relationships, and we feel that it's important that the healing occur in relationships as well to reduce the impact ACEs does have on children and families. So child trends identify tribal sovereignty as critical for addressing the resource needs and developing sustainable ACEs prevention and intervention strategies. We partner, our local partners address ACEs among American Indians and Alaskan Natives. And we acknowledge that the tribes have access. We want them to have access to policy programs to address their health and well-being. Federal policies are critical for tribal involvement and should have collaborative consultations with Native Americans and tribal leaders on a regular basis. Our state and local level collaborations with tribes and other agencies. We work on program initiatives, funding mechanisms, services that can enhance and ensure that their tribes take part in and benefit from our services. And part of our services, we do a lot of services, and Angel mentioned some of those briefly. We do drumming, we do song, we do dance, and we meet weekly, just as a side note, at Jastrow Park for our drumming and ceremony events.
Evelyn, if I may interject, I know a large part of our audience is, in the profession of counseling. And, when we think of these things, what are some of those implications for the professionals who are in the counseling work? part of what we're sharing today is to really make individuals more aware of the sensitivity that it takes when you're working with the American Indian Alaska Native people. We have partnered with a few collaborative agencies to really standardize Native American training that is more relevant to this region. The thing with Native American communities is that they have a lot of similarities, but they also have a lot of differences. And so we have to be very respectful and very sensitive when we are working with the indigenous population. More specifically, in Central Valley, you have a very rich, diverse makeup of American Indians who may not share what other tribes or Indians, bands of Indians, consider it being appropriate for their own tribal community. And so there are implications. You know, there's a research that was published in the Professional Counselor, the journal. This study really looked at like integrating the mainstream mental health interventions in Native American individuals should evolve in two phases, like the motivational phase, which is the historical context around current difficulties in Native American communities was discussed. And, you know, B, the intervention phase, meaning the utilizing mainstream evidence-based interventions. Not only do clinicians and interventions need to be culturally competent, but conventional counseling theories need to be adjusted to be culturally appropriate. And that was a study by Dion Davis, Sheaver, and Madrigal. And it alludes to the point that I'm trying to make, that much of what we do, sure, includes evidence-based practices. However, a large shift in the paradigm of our clinic and our operations and the types of services that we offer has really taken on more of a community-defined approach. And this community-defined approach allows for us to listen to the voice of our people and draft a model of care that serves the needs or the unmet needs of the people we serve. And so the community-defined practice really is how we can culturally and sensitively provide these services to our people. You know, I always share, and I'll make this very short because I know we're running out of time. I believe, Johnny, we have till 12:30 or 12:10. We're going to do some questions. 2 minutes. 2 minutes. Okay. And then we're going to open up for questions. One thing that I want to point out that I think is very helpful for all of you who are listening in is don't be afraid to ask the question. If you're, you know, I had a gentleman that I met yesterday, a Caucasian gentleman, very kind, was here, great outreach and collaboration. Long story short, he asked, he said, hey, please forgive me. I don't know anything about Native Americans. And I'd like to learn more, but just curious, you know, and again, he was being apologetic. How many chiefs are in Kern County? And, you know, I said, you know, I'm glad you asked. I'm glad you asked. And I gave him a little bit of information. I said, you know, we don't use the term chief, we use the term chairman. You know, we have chairmen of tribes that are their leaders. Similarly, like a chief in a tribe. However, there still exists chiefs in Native communities. It's not so relevant for Kern County. So again, that's just an example that I share, that it's okay to ask, be very sensitive. You know, it's always best just to ask. Don't pretend you know, don't make an assumption, don't go off of what someone else has shared with you, because that might not be a generalization that might be valued in that specific community of Indians. Turn it back over to Ms. Evelyn.
What we do at Bakersfield American Indian Health Project is we ask about their trauma histories. We have them fill out a adverse childhood experiences questionnaire. Once we have that, we will continue to explore the presence and impact of trauma with the individual. During the assessment, we formulate a trauma-informed treatment plan. And it is culturally appropriate, along with ongoing trauma-informed treatments that are culturally appropriate, trauma-focused CBT, eye movement desensitization and reprocessing. We use trust-based relational interventions, dialectical behavior therapy. All of these treatment modalities are culturally appropriate, and we include all of the cultural interventions within those modalities. When we talk about reviewing the trauma, we also provide some supportive services for our families. We have emergency housing, food, rental assistance, utility assistance, residential treatment if they need it. We also refer our natives to our youth group for children 12 to 18. We have a parents of preschoolers group. We teach parenting and child development to help them get off to a good start. We have an elders group. We also have an elders and youth gardening group to pass down education about medicinal plants and herbs and what's valuable to natives. So, and I think that's the end of my presentation.
So again, thank you so much. We appreciate your time that you dedicated with us. You know, we're very proud. We always use this slogan as an identifier of us, is that our feathers soar higher than everyone else's. Benahu, thank you. So John, let's get off the the presentation, and then maybe we can take a few questions. Anna Lee, if you can work with Johnny on those, be happy to answer any questions.
Yeah, absolutely. Thank you to the Bakersfield American Indian Health Project team for this wonderful presentation. I did ask for you guys to enter your questions into the chat. I believe we have one question, so I will allow Charlene to read that out.
Thank you, Annalee. The question is, what would you recommend as far as the best approach and open communication with my Native American patients about ACEs?
That's a really good question. You know, there's probably not like a one answer that's going to fit all. I think I always, when I talk to counselors, and I'll turn it over to Miss Evelyn for her input as well, is that if you make the space culturally relevant, you're going to have much more success in connecting. You have to make a connection. It's all about trust, right? And that takes a long time. Things like, you know, we have a lot of, our clinic is very indigenized, as you can tell. And so, you know, a small drum, a feather, a picture, pottery, a basket that's weaved that's on the side of your desk. You know, many communities of natives identify to these types of rituals, and they value, you know, these types of artifacts. And so I think that sometimes when you're engaging with someone just by having indigenous art or anything like that could really help you connect or make the connection and open the door for that intimate conversation that's needed to lead someone to a path of wellness. Ms. Evelyn?
I think the most important thing is when you're talking to elders and adults in the Native American culture is to ask them permission. And can I have your permission to fill out this form? Can I have your permission to talk about your family, your history? They want to know they're being respected. And my office has drumming equipment, it has photos and different things in it. So I think that's very important. Just having those tokens it relaxes individuals and they can see that, oh, you know a little bit about our culture. And they're a little bit more willing to talk about it, especially if you ask permission. And I haven't had any problems relating to any of our Native population. They're very respectful. I would start with that.
That was a great answer and just a great reminder in general. Wow, I really appreciate that. Another question is, what is the address of your new center and what's the vision for your new building?
That's a great question. It's 501 40th Street. Cross Street is San Dimas. It's just a block over from Memorial Hospital. And that new site is going to allow for us to implement full-scale cultural programs. Many of the ones that just Evelyn touched on, like the gardening, indigenous gardening project, basket weaving, beading, the veteran. We have 2 board members that are veteran as well, and they're going to run their veterans group out of the Indigenous Wellness Center. Mostly talking circles, healing, creating safe spaces for wellness and resiliency and recovery. And all of that is going to be integrated with our medical department. As far as our medical department, we specialize in special diabetes programs. So right now we have nutrition classes. So we have a nutritionist who engages with a group of our elders, specifically the chronically ill elders who require intense care. And so there's we offer these platforms for our elders to be involved in, like bingo size, which is education, learning, and exercising, learning how to care for themselves a lot better. Injury prevention programs. We're well funded through various special projects. So on the medical side, that's going to include a lot of infection and prevention control. We have funding to also have our providers do site visits, meet people where they're at, specifically for like our bedbound patients that cannot come to the clinic. We have transportation services. I left that out earlier in my presentation, but we also offer transportation services for all ages. We offer those at no cost to our our American Indian patient population. And so we've expanded that. We're going to expand that a little more. Through some funding, we were able to acquire transportation vehicles that cater to the disabled, elderly, and non-elderly, just all ages. But we have a lot of elders that are disabled, that have physical impairments. And so our conventional transportation vehicles were not meeting the need. And so we're very excited. I mean, it's a lot more, but that's just a short list. But we're going to focus on behavioral health and expanding those services, as well as our medical department. And we're going to work from there. And that's really the vision of the board of directors and the staff that work for BIHP. And the last 2 years, we've grown. We've outgrown the space we have here. And so that really was a big push for us to purchase a new building and be able to accommodate space for all of our staff.
One of the things that we do to identify our clients' needs is we run a survey, and we have them complete a survey at all of our events asking what kind of services they would like to have. And that's what we base our services and our growth on, is their request for services.
Okay, and then we're almost out of time. So this is the last question. Will the program be open to the public, and are those services listed on your website?
Yes, the program, the Wellness Center is going to be inclusive to all Indigenous populations. So they are welcome to participate in a lot of our cultural and traditional approaches for care. The new site the way we're funded right now only allows for services like transportation services, medical services, some behavioral health services, not all, like substance use disorder services are only tailored for the American Indian Alaska Native communities. However, there are many other services like the vaccine, for example. Early on last year, in 2020, we rolled out our COVID-19 vaccines, and those vaccines, we were offering it to all. So you didn't have to be a Native American to participate in that service. All prevention services as well were some of those services that we offered to the general community. Our events is another great way of really being a part of what we do. Our events have always been open to all. And, we have a calendar of events in our website, so definitely visit us there or follow us on Facebook. We have our own Facebook page. And those events, we have about 5 main events each year. And so that's another way where people can take whatever resources we offer to the community there as well.
All right, thank you, Angel, Evelyn, and Johnny for that excellent presentation. And thank you, everybody, for your wonderful questions. I know that there was a few that were not answered. I encourage you to enter those questions into the WOVA app, into the community section. First Five Kern is going to be working on a document to answer some of those questions that were not covered during these workshops. So before I let you go, I just wanted to let you know that the next session will begin at 12:30, and that is going to be the exhibitor live question and answers and lunch that will allow you to visit several community vendors who have really helpful information regarding the services that they provide in Kern County and allow you to connect with them as well. The afternoon workshop begins at 1:45 to 2:45. So I hope that you enjoy the rest of this conference, and of course, stay connected through the WOVA app. Any questions that may come up, you can enter them there. You can connect with First Five staff as well. So thank you, everybody. Again, thank you to Bakersfield American Indian Health Project. Have a great afternoon.
Thank you.